If I walked into your home right now, opened your medicine cabinet, and picked one bottle at random, there's a real chance it was never meant to be there this long. Let that sink in. Not because the drug is bad, but because something much quieter happened, somewhere between the first prescription and the fifth refill. No one stopped to ask, do you still need this? And that's where the real danger begins. Here's the truth most people never hear. Many medications we take every day were only tested for weeks, maybe months, not years, not decades. Yet people stay on them, silently, while the body slowly adapts, compensates, and sometimes pays the price. We're talking about things like memory changes, nutrient depletion, kidney stress, even physical dependence. Not overnight, but gradually, almost invisibly. So today, I want to walk you through a few of the most common ones, and more importantly, what your body is actually experiencing inside, and what you can do instead, gently, safely, and naturally. And just to be clear, this isn't about fear, it's about awareness and better questions. Let's start with one of the most common heartburn medications, also known as PPIs. Now on the surface, they feel like a miracle. You take the pill, the burning stops, you feel normal again. But here's what's really happening. Inside your stomach are tiny acid pumps, constantly producing acid to break down food. These medications shut those pumps off. And yes, the symptom disappears, but the cause, still there. It's like removing the battery from a smoke alarm. The noise stops, but the fire keeps burning. Biologically, when acid stays low for too long, your body struggles to absorb key nutrients. Magnesium, vitamin B12, things your nerves and brain depend on. Over time, that can feel like fatigue, brain fog, even tingling in your hands and feet. Emotionally, it's frustrating. You think you're fixing the problem, but something still feels off. So what's the real fix? 3 simple levers. First, reduce pressure on the stomach. Even small fat loss around the midsection lowers the upward push of acid. Second, strengthen the valve that keeps acid down. Deep belly breathing trains your diaphragm, like a natural support system. And third, help food move faster. A short walk after meals, even 10 minutes, can change everything. Now, before we move on, pause for a second, because this is where most people realize they've been managing symptoms, not solving problems. And if this is already opening your eyes, if you found this helpful, hit the like button, subscribe to the channel, and share this with someone you care about, because the right information can change someone's life. Now, let's talk about sleep medications. This one surprises people, because they work. You take it, and you sleep. But here's the hidden trade-off. These drugs act on something called GABA, your brain's natural off switch. They press the brakes for you. At first, it feels like relief. But over time, your brain notices the shortcut and starts removing its own brake receptors, meaning your natural ability to fall asleep weakens. So now, you don't take the pill to sleep better. You take it just to feel normal again. That's dependence. And day to day, it can feel like grogginess, poor focus, memory slips, like you're never fully on. So what actually helps? Consistency. Same sleep time, same wake time, even on weekends. Morning sunlight within 30 minutes of waking. That light resets your internal clock more powerfully than any pill. And at night, dim lights, quiet routines, signal safety to the brain. Because sleep isn't forced. It's allowed. Next, a category almost nobody talks about, but it's hiding in plain sight. Anticholinergic medications. You'll find them in common allergy pills, sleep aids, even some bladder medications. Here's the issue. These drugs block a brain chemical called acetylcholine, which is essential for memory and learning. Short term, you feel drowsy. Long term, the brain pays attention. Studies show a clear pattern. The more exposure, the higher the risk of cognitive decline. Not instantly, but gradually, like a dimmer switch slowly turning down. And emotionally, that loss of clarity, of sharpness, it affects confidence, independence, dignity. So what's the smarter move? For allergies, switch to newer antihistamines that don't cross into the brain as much. For bladder issues, simple training techniques and pelvic exercises can dramatically improve control. No pills required. Now, one more that's quietly everywhere. Gabapentin, originally for seizures, now used for nerve pain, anxiety, even sleep. It works by calming nerve signals, reducing noise in the system. But over time, that same calming effect can dull the brain. People describe it as feeling slower, foggier, slightly off balance, and physically, that can increase fall risk. But here's the deeper issue. If the pain is from something like diabetes, then the root cause is blood sugar, and no medication can outcompete a system that's still under stress. So the real shift? Stabilizing blood sugar through food, movement, Muscle use. When the internal environment improves, the nerves follow. Now, take a breath for a second, because this isn't about throwing away your medications. It's about asking a better question. Is this still serving me? Because your body is always trying to heal, always trying to rebalance. It just needs the right conditions. And the truth is, small changes, done consistently, can restore comfort, clarity, and confidence. You are not stuck. You are not dependent forever. You are simply one decision away from a different direction, and that is powerful. So check your cabinet tonight, have the conversation, take that first step. Because your future health isn't built on quick fixes. It's built on awareness and quiet, intentional choices, and I'll be right here, helping you make them.